Annika is challenged.
Zero Charlie to Naughty Boy. Are you set?
Almost ready.
Going undercover takes on a whole new meaning when the backup team are involved.
Zero Charlie to push back a one.
We're just getting in a position, over.
And there are plenty of surprises.
CID. Who's your boss?
Do not pass go. Do not collect your pension. Go directly to jail.
Especially on the romantic front.
I think I'm in love.
Backup, tonight at 9:30 on BBC1.
A year in the life of 5 of the inhabitants of Holy Island on BBC2 in a moment. It's a world at a different pace. In Picture This.
When you get the call, you've just got to go.
Look out, police car ahead.
But not too fast. 2.4 Children, Monday, 8:30 on BBC1.
A problem shared means a full in tray for Maureen Lipman in half an hour on BBC1. She's an agony aunt with attitude. Before that, there's a packed waiting room and none of the patients can read the magazines. In Animal Hospital.
G'day, welcome back to the Harmsworth Animal Hospital in North London. It's been quite a dramatic week here with vets and nurses really being put to the test. It all began Monday morning when an owner brought in a feral cat that she'd taken on. Things started quite calmly, but that was not to last.
It's Otto, isn't it?
Yes. I think he's got some kind of infection, cat flu or something, because he wouldn't eat yesterday and he's dribbling and coughing. And his breath was very short, panting.
Oh, he's very
short.
Yeah, he's very, very bunged up there. I can hear him wheeze.
He looks very under the weather, doesn't he?
He looks very down.
He was so healthy. I brought him in sick fish breakfast.
So he was doing fine until yesterday.
Yes.
Fine.
He was eating well, twice a day.
Well, Otto?
Poor darling. I was never going to have another cat after my last one.
Yeah, he's got a dreadful chest, actually. He's not in pain, but he's actually distressed because he can't get enough air into his lungs. He's actually distressed.
What can be done to...
I mean, he's got great powers of healing. With a bit of luck, hopefully his chest will come back again, you know. It just is very, very creaky at present. It's like a barn door inside there at present.
But he showed no sign until yesterday.
Well, the problem with cats is that, you see... Okay, Pet, did he get you off?
Yes, he did.
Did he break the skin?
Yes.
You better wash that fast.
Yeah.
Hang on there for a second. I'll get Rolf organised here. If you wash it here with some antiseptic.
Okay.
I don't know what to do about him.
Oh,
Now he's getting very wild.
Oh! Oh, God! Are you okay? Lita, come here and hold this cat.
It's a bit like...
Do you want to wash your hand there first? Yeah. Take this cat off his lady and give us some Lasix. It's quite bad, okay? You come round here.
He's getting very wild.
I'm sorry, the cat's quite... I was going to give us some injections. Quite...
Don't let him bite you.
No, Pet, okay.
He's a wild cat.
It's not his fault. He's actually just very stressed, actually. Come on, Pet. He's just very stressed with his breathing.
But yes, put the...
You would wash your hand with the tap as well.
Yeah.
Come over here, look.
Come on, Pet.
Bit into the bone.
Come on, Pet. And yourself there.
Put some of this on your
He's
first.
got a very bad chest. I want him to... He's not his fault. He's actually had to breathe. Poor fellow.
Gosh, it's nasty, isn't it? I'm not under the tap for a while.
Let's see your hand. I just want to see... Oh, my God. You want to sit down in the chair here a second? Put it down there.
Can you just have a look at that?
Yeah, cats do carry a lot of poison on their teeth. And that was like an injection of poison into your finger there. So what you must do is go and see your doctor immediately when you leave here. Because you might want to give you some antibiotic treatment as well. Because we get cat bites here quite commonly, and they can, if neglected, they can cause the whole arm to swell up sometimes.
A scratch with the claw.
You'll be okay, Rolf. You live.
No sympathy for me there. It was frightening enough being my size and being on the end of that, but can you imagine what it would be like if you were this big?
We got here Gerbil.
Gerbil.
What's her name?
Honey.
Honey, or is this a female?
Yeah.
And what's the story with her? What's she been up to?
The cat's had her through the cage.
Oh, gosh. She lived to tell the tale?
She's got a bit of a tail left. And
oh, boy. Let's have a look at her then. Who's going to hold her? Did she, what, the cat sort of put the paw in the cage and started clawing?
Yeah, and it's caught the side of her as well.
Oh, dear. That's not very nice, is it? Got a nasty gash there, haven't we? I think we're probably going to have to stitch that and do something with the tail. Look, this bit of the tail here is dead. Do you feel that?
Yeah.
It feels just like a dead piece of wood.
Yeah.
That's because the blood supply's gone. So obviously we can't leave it like that. We will need to remove that. General anaesthetic in a little creature like this is a bit risky.
She's only 4 months. Will she survive the anaesthetic?
Well, I wouldn't be telling you the truth if I didn't tell you there's a risk to it. You know, these are tiny little creatures for anaesthetics. But we can't chop the tail off and stitch her up without giving her some form of anaesthetic. So I think we're just more or less forced into the situation where we've got to do it. So there is a risk, but we will be as careful as we can. So I think that needs to come into the hospital now. There we go.
And this goes in there?
Yeah, that's right.
The tube that Honey was trying to escape into was in fact carrying the anaesthetic gas into the plastic bottle. And after a few moments, it did the trick.
Well, we can put her into the bubble wrap. The wrap is a kind of insulation to keep her warm.
Saving a gerbil's life with bubble wrap is one of the more unusual techniques used at the Harmsworth.
Just one stitch?
Yeah, I'll put another one in as well.
How do you monitor the anaesthetic procedure, Jo?
It's very difficult on one so small, but really breathing is the only way that we can really tell. And when the breathing slows down, I'm just taking it off for a few seconds of oxygen.
Yeah. Finally, the dead part of the tail was cut off.
And that'll heal up quite well. We'll cover it with antibiotics as well. At least we've got it to a nice length. It looks much more cosmetically acceptable. And we have got the suture. I've put 2 in and it'll heal quite well.
A short time later, Honey had fully recovered and was raring to go again. I always knew there had to be something else you could do with bubble wrap. It's not just owners who bring injured or sick animals into this hospital. Every day, RSPCA ambulance drivers are also bringing in animals that they've rescued. Reporter Mary McHaffey spent the day on emergency call.
So was it busy last night?
No, it was quiet. I only had the call for duck. They'd been hit by a car.
It's 8 a.m. at the North London ambulance base and night driver Kirsty is handing over to Kieran and Ned. A team of emergency drivers covers the whole of London round the clock.
So how did you decide who does what? Oh, who does what part of London driving?
Just basically decide between us when we come in the morning as to which area we prefer to do. It's nothing in regards, it usually comes down to which area we know best. It's easiest for us to actually get around fastest.
I joined Kieran covering the North East and we were soon called out in our first emergency to an injured cat.
Hello there. The cat's
Hi.
down here, is he?
Yeah, just down.
Oh yeah, I can see it.
Oh yeah, you can actually see cat's tail down there. So what actually happened?
We come across the garden, went back out through there, and he just crawled into the hole down there. Dave went in and had a look.
The builders working next door had seen where the cat went and had called the RSPCA for help. Is he still conscious, Kieran?
He is, yes.
And do you think he has been hit by a car?
Yeah, he's got a broken hind leg.
Oh, what a shame.
He's also got identification. Oh, nice for that.
The cat's home was just a few doors down.
You got your own vet, sir?
Mine what?
Vet. You got a veterinary surgeon for the
I
cat?
usually take him down. He hasn't been to a vet for a long time. Is he all right?
He's got a broken leg. Don't know what else is wrong with him, sir. So we'll what we'll do is we'll take him back to the hospital for you. We'll get the vet to have a look at him.
Yeah, will you do that? He's been in the house 18 years.
Yeah. How old is he?
He's
18, yeah.
Oh, poor little. He doesn't go out. He must have got out while I was working downstairs.
The cat was also suffering from shock. Kieran took him straight back to the hospital where he was given immediate treatment.
a heron that has possibly a damaged wing on Camden Lock, and it can't seem to move. I got
Within minutes, there was another call.
I'll head down there now and have a look of it. Right, we've got an injured heron call. It's in Camden, not too far away, so we'll take a run down and see what we can do.
Definitely. Okay. We went to rescue it, but by the time we got there, the bird had gone.
Did you see any injuries with him at all?
Yeah, his right wing from about here to here is all soft and kind of like...
So it does seem to be hanging down, does it?
Yeah.
Right.
I mean, he can take off, but he can't really fly very far, is what I think.
Right, well, he's obviously gone now. Now he's either gone up or down the canal.
Yeah.
Nothing we can really do at this point, but he will be back. If he does come here all the time, he will be back.
He'll probably come back once you've gone.
Yeah, that's it.
So is this something that happens quite a lot, that
It
you may
is.
get called out and the animal won't actually be here at the time you get here?
It's quite common, especially with wildlife.
We had better luck on the next call. This time, the bird hadn't flown.
What's the story?
It appears that it's damaged its right leg when it's landed.
Right, so he was actually flying over and he came down.
Yeah, he's come down, yeah.
Did he hit anything at all, do you know? Or?
We don't think so, no. It's quite
It doesn't look too badly injured. You say one of his legs is injured, you
He's
think?
limping on his right leg.
So, yeah, I'll have a look at that. Might not be anything to worry about. Does he? All right. Okay, all right. Good boy. Come on.
Injured at all?
No, he's not. He hasn't injured himself. So I'll take him along to the nearest stretch of water and let him go to see how he is from there. But no, he said he was limping, but I think it's probably just bruising. He'll be fine. But swans are quite common in the London area, and especially juveniles. Again, they're just inexperienced. They come down in all strange places. All right then.
Thanks a lot.
Yeah, thanks for your help. Cheers.
Thank you.
All right, thanks, Albert.
Kieran soon found the right spot, but the towpath entrance was locked.
All right, sit down. There you go.
Oh, it seems fine.
Successful release.
That's good. Now, I don't think I'd have to remind any dog owner just how keen most of them are on walkies. Well, with the possible exception of the next animal who turned up in Barbara O'Malley's clinic.
Right, so what's wrong with Soda today?
Well, is it this poor here? Today I took him for a walk.
Right.
I mean, as I said, he's a bit of a hypochondriac. He don't like going out at
Is
all.
he? All right.
But he tries
Bit of a
to,
wimp, is he?
Yeah.
Right.
But I put him out today, and he usually walks right beside me, but today he kept sitting down, not wanting to walk or anything, and lifting his paw up.
What age is he now?
It's only 17 months.
He's only a baby, 17 months. Right. Yeah. Only a
Does he
baby.
like exercise? No, he don't like exercise at all. You put my trainers on, and he starts walking backwards back into his bed. It's the only dog I've seen like it. Don't like going out at all.
He's a bit dozy one, isn't he?
Yeah. It's been happening for a while, but
Okay, let's check
today...
his knees in. You just hold him still. Yeah, hold his head on there. All right, Soda, you're going to stand up, I'm afraid.
Come on. Soda, there's a good dog.
Okay. Was he particularly active yesterday? Was he kind of playing with the ball?
He's never
or
active.
Not even active for him, like?
Yeah, he was all right. I mean, like, today he was all right.
Yeah.
He was marching on, but...
I mean, it's difficult to say just by feeling there. Really
Yeah.
did require x-rays as well to see how bad the problem actually was. But it's a bit early yet to
At the moment,
rush
I'll
in an
just-
x-ray him
yeah.
yet. I think what we'll just do is just rest him for a few days and
Someone's
see if he
going
gets
just being
better.
crafty on me again, not wanting to go for a walk.
Yeah, maybe it's
Because
like...
it was when I walked past the pub.
Yeah.
Because usually you like dive straight in the pub, but he walks in any pub, so there's where to sit down and that. But today, where you see the pub, and that's when he started.
Special pubs, my God. He's not stupid, is he?
As soon as I got past there, it was like, oh, we ain't going in there, oh well. Sore leg. What should I do? Rest him, see how he goes. If he still ain't better, bring him back.
Yeah.
I mean, resting ain't no problem. for him
Rest
anyway.
until next Monday, then bring back for a checkup. I think he'd be quite happy
No
with that
problem,
anyway
yeah.
as well.
Complete rest. I bet that dog couldn't believe his luck. Every now and again, The vets here have to try and treat animals that have most of the cards stacked against them. Our next story is about one of those.
Hello there.
David.
What have we got here?
We've got a litter of 4 kittens. Found out that the mum's been knocked over. They've been eating and drinking quite well up until last night. Yeah, they know what to do. But this one here, he's got no life in him this morning at all. Yeah,
Let's move this out of the way for the moment and have a look at this little chap. I'll do that, yeah.
He's on his way.
This one.
There's 2 of them.
This one is actually dying. You know that. I'd be wrong if I told you I think I could do anything with him. And another one is, let's just pop him back gently for a moment, shall we? And the other one that you're worried about?
This one. No, this one. This is the one. See, they're also pooing blood.
Are they?
Yeah. This one special.
Which are the 2 good ones now?
It's
this one and this one.
And this
we'll try with
that one was actually the worst one.
We'll try with all 3, and we'll
and
let
this
one
one's
go.
not so bad.
No. Well, let's give them some injections now. Can you hold on for me? And we'll get them into the hospital and do our best. But let me warn you, it may not work out the way we want it to.
You've got very attached to them.
Yeah,
already.
I like animals. I mean, my dogs were stray. That's how I got them, and so is my cats. So I just go around collecting strays, basically.
Oh, I think you should call a halt at some stage, though. You don't want to end up with too many, do you? Because then you can't look after them properly. Also, you set yourself up for some heartache, haven't you?
There you go.
And this little chap,
He's dead.
we're going to have to, if he hasn't gone, we're going to have to help him on his way.
He's gone.
Gosh. Okay. Just passed away in front of our eyes. Well. All right, well, you take a seat and we'll get them taken in. Give us a buzz tomorrow and we'll do what we can.
Sadly, all those kittens died. It's not easy to keep orphan kittens alive when they're that young. Even with all the skills, the know-how and the simple loving care that's available in a place like this, they sometimes die. Karen, that's a fine-looking young fella. How old do you reckon he is?
He's very young, this one. He's probably about 2 to 3 weeks.
How difficult is it to keep them alive when they're that young?
It's very difficult when they're tiny. They do really need their mums at that age. With the feeding, you need to do it about every 2 hours during the daytime, so it's quite full time, and during the night as well.
Yeah.
Yeah, you have to keep going through the night.
Well, he certainly looks as if he's going to make it. He looks great, doesn't he?
Yeah, I think he's going to do well this one. He's feeding well.
Good. But he's still an orphan, and he's still going to need a home. In fact, this whole ward is full of stray cats that need homes. And it's not just cats that need homing. Earlier this week, reporter Steve Knight went along with Richard Thompson to take a variety of animals to the Mount Noddy Rehoming Centre in Sussex. The first one was a hamster that had been put out with the rubbish, if you can believe that, and had been rescued by the RSPCA.
Much better home for it than the rubbish bins near Canary Wharf.
Absolutely. It's a nice hamster too.
So someone might come and take this hamster for a new home tomorrow, hopefully. You never know.
How'd you like it down here, John?
John Brookland is the manager of the Mount Noddy Animal Rescue Centre, and he used to work at the Harmsworth Hospital back in London.
Yeah, nice to be in the country.
Yeah.
You used to do Richard's job?
Yes, yeah, I left there about 5 years ago.
Right.
And then came down here for a bit of a change.
Yeah. Better close the gate, yeah?
Yeah.
There we go.
Right out, there we go. Careful, there. Up straight into the grass.
I think this duck's going to go bolting out to follow her.
There we go. See what you think of the pond. Straight in.
It's great, isn't it? The hen straight for the grass and the duck straight for the water.
Straight into the...
Oh, that's good, isn't it?
Been waiting for that, hasn't it?
Yeah.
Getting rid of the London dust.
Yeah, I think we've got approval
there.
Yeah.
Looks like a well-fed duck.
It is. As well as a duck, a chicken and a hamster, several rabbits needed rehoming at Mount Noddy.
Yeah. Well, we're probably one of the smallest RSPCA animal centres. We don't have many animals here. We have a great success in rehoming. We home most of the animals within 2 or 3 weeks, so they're not with us long.
What made you make the move from the Harmsworth to here then, John?
I just really fancied a change, to do something different, you know, within the RSPCA, and change to this side of rehoming animals, which we find quite, you know, well, I find quite satisfying.
One exception to their success at rehoming is a friendly dog called Toby.
He's been here for nearly 4 months now.
4 months?
He's a really affectionate dog and likes playing with a hose pipe and toys. But his main problem is he doesn't like other dogs, and he's not the kind of dog that you can trust off a lead, or even when he's on a lead, if you meet another dog, he's not too happy about meeting them. Yeah. That's nice, isn't it? Hey? Yeah.
And if you want to rehome an animal, please don't ring the hospital here, because you might block an emergency call coming through. All the information you need is on CFAX page 625. By the way, you're too late for that little hamster. We've just heard that he's already got a new home. Now, when we have an accident, we can usually tell our doctor what has happened, but vets quite often have to rely on detective work.
Oh yeah, just hold his head up gently while I just check his leg here. He's got a very nasty wound. Look at that, Rolf. That's pretty awful. And on his tummy as well. Can we just roll him gently onto his side? Just very gently. He's very sore. Sorry, push. That's it. That's it. Right.
There's a good cat.
That's what he's on. Oh yeah. There as well.
Do you think that's an attack
I just want to check.
from another animal?
No, he's been involved in a car accident actually.
Look at that little...
Well, I think, well, the reason why I know he's probably involved in a car accident, if you look at his claws there, Rolf, you see the way his claws are very scuffed. See how they're kind of all down to the bone, literally. And there as well. When they get hit by a car, they drag their claws on the road, on the tarmac of the road, and get very scuffed claws. So it's a classical cardinal sign of a road accident, actually. And this cat has been dragged on the road by a car. These are always called a shearing injury. You shear the flesh off, basically. So he's very lucky to be alive. He's got very severe skin injuries there. It's almost like a very severe burn on as such. And I'm afraid all that flesh there will actually fall off. It will actually die and fall off, leaving a big gaping wound. What he will need is quite drastic hospitalisation for a few days to treat those wounds quite seriously.
What no one knew at the time was that BB had a serious internal injury as well.
After the accident, we gave him a light anaesthetic and made a few stitches here. He's got lots of wounds here still. And then we found he had some very major wounds on his tummy and his armpits here. And this is why he's wearing this kind of body bandage to help relieve the pain.
So what do you plan to do now?
Well, while he was out on Friday, we found this huge swelling in his back leg here, which is a hernia. Now, a hernia is where if the car makes impact with the body wall, it creates a hole in the muscle. And through that hole, all the intestines can come through very easily and spill out and cause a swelling here.
Barbara O'Malley cut through the abdomen to locate the site of the rupture.
I'm going to try and push all the guts back. And then try and look for the tear. It's probably quite a rough tear. They always are in these kind of accident cases.
I don't know whether you realise how amazed we all are at these jobs you do daily.
I see these all the time.
Can you remember the first time
I'm
you
just
did something
laughing
like
because
this?
my first operation I ever did as a new graduate was actually a hernia. I had a cat in which I just thought was constipated. And the senior vets were really nice to me. They gave me this little simple enema to do for the new graduate. And when I had anaesthetized the cat, I found, unfortunately, it actually had strained so much it had ruptured its muscle wall like this and caused a hernia. So I had to go in straight away and operate. So it was my first ever operation as a new graduate, which is pretty daunting because it is quite tricky surgery, you know.
Well, here's BB with Aidan and Mark. Now, that looked pretty touch and go for a while, didn't it?
Yeah.
How is he now?
He's very well, actually. He's still got a bit of a limp, but he's managing to climb 3 flights of stairs at home.
And the skin healing all right?
Yeah, he's lying on that now, which he wouldn't do before. So.
Well, thanks for bringing him back in.
No problem.
If Barbara had to play detective at the start of this week, Jeremy Stewart had to do the same with a different patient who was a bit off colour.
So, what have we here?
Your communal garden green iguana, who's not so green anymore. He's turned a bit yellow, not a lot, but a bit yellow, which I'm a bit worried about. Right. And he can't use his hind legs, they're totally sort of flaccid.
They are quite, aren't they? But his appetite's fine, is it?
Yeah, it seems to be. I mean, he's been eating recently, but ever since Friday, his legs are just floppy, and they don't feel broken. He's not in pain, and he can use his tail.
He won't have fallen from any height or anything like that?
He wanders around the flat where I live quite a lot, and he jumps around, but when I put him in his cage on Friday, he was fine. And I find it a bit odd that both limbs have gone.
I mean, in all honesty, if it was a normal, one of the species that we see normally here, a cat or dog, for example, then these sort of symptoms, the completely off the back legs, it's very likely that this has happened as a result of a fracture.
Right.
He's certainly very weak and not really very keen on moving these legs around.
No.
You say he's gone a little bit yellow as well?
Yeah, his tail's gone a bit yellow, which he normally does when he sheds his skin, but he has gone quite a bit yellow, and I didn't know if it was a vitamin deficiency or...
To investigate this further, really, you're going to have to think about perhaps taking some x-rays and finding out whether there's a break there. I'm really struggling to give you a prognosis or to really tell you how bad or otherwise this condition is, I'm afraid.
Following an x-ray, the picture became much clearer.
I think we can see what the problem is. On the left lower leg, you can see there's an area here where the bone is actually broken, and it's got a pathological fracture of the leg. You also, looking at the spine, can see that there's loss of definition of the spine along its whole length against the soft tissues. This, I would say, is a nutritional problem. The bone is being absorbed because it's not eating the right diet.
It turned out that Jeremy was right, and the iguana is now being treated by a specialist. Well, if the week began dramatically, it certainly ended that way too, when 2 police officers rushed a badly injured dog into the hospital. Nurses Lizzie Lamb and Sam Holloway took over. The dog was a lurcher that had been found wandering around in a state of shock. She was stretchered straight into the treatment room and collapsed before Jeremy Stewart began his examination.
98 just now. I think the back, the police think the back is damaged.
We've got no note for it?
No. In the public found as a stray.
She's extremely shocked. Obviously, immediately after having been hit by a car, then all the blood basically goes to completely the wrong place. It's supposed to be supplying the heart and the muscles, but because she's shocked, she doesn't have really any control of where the blood's gone. That's really the most important thing at the moment. Her hydration status is quite poor. I think there's going to be some quite serious injuries here, but the problems that may be associated with her back, she's certainly got feeling in her back legs, but if those are secondary at the moment. At the moment, if we don't get her onto get her into intensive care, give her intensive intravenous fluids, and give her some painkillers, then I think she's going to die.
Things look bad, but remember, they are very good here, and they will do all they can. Let's keep our fingers crossed for the dog. We'll let you know one way or the other next week, so see you then. Bye.
There's an update on the cases in tonight's programme on Tuesday afternoon at 4:25. Next tonight on BBC1, Maureen Lipman dispenses the therapy in Agony Again.
in this week's 999 Lifesavers.
We could win the European Cup in the next 2 or 3 years. Got to win the league first, obviously. But if you're talking about catch 'em up in terms